Well, I'm happy to have this wonderful crew from Terry Hart. Why don't you introduce everyone? Terry, and give a little background. You've been in radiology business for how many years, sir?
Oh, good Lord. I think I started in the mid 90s. So I don't know how long that's been. It was probably a third career for me. I was a professional musician. I managed a restaurant. And then some guy just kept wanting to hire me to do X-ray sales. And I had been trained out in LA on yellow pages by the phone company. So I knew how to sell. And I kind of, you asked me 30 years ago where I'd be, I never would have guessed. But it's been good, no complaints, and I've been able to bring the family in and make them a part of it. So Jeremiah and Kevin are doing very diligent work with X-ray. So I'm trying to phase out of it slowly, but they're kind of picking up the ball. They do most of the traveling now, and they're very good at what they do. Kevin has a background. His degree was in what was it, Kevin?
Graphic media design.
I thought it was flipping burgers.
Nope.
Well,
that was part-time.
graphic media design. So he's got a real handle, and he's a drone pilot, does a lot of drone work. But he's got a real handle on the electronic end of what we do, and he's our trainer. He's very good at what he does, and we stay fairly busy.
So Kevin
runs our
Jeremiah.
sales.
Okay.
Yeah, he runs their sales effort, and he's very good at what he does. He's built up, a nice following, and he's getting better over time.
Mhm.
So it's all good. And
well, I'm excited to announce a joint venture with your team, and the fact that you're now going to be offering Softwave and becoming really sub distributors for us. And thank you. I mean, you guys have developed such a great reputation, and you have such a wonderful group of doctors out there that it's just a natural progression. So let's get into like why this is important, why we have placed this in over 1,000 clinics in the last 5 years, and how we're in 1,600 clinics globally. So I'm gonna share my screen. Just make sure you guys see this. Where it is. And this is a little presentation that we're gonna review and run through, okay?
Sounds good.
Awesome.
And it's like, I love this quote. Nothing is more powerful than an idea that has come. And really, the OrthoGold 350, that has come. It's, to me, I've been a chiropractor 30 years, and it's one of the most versatile medical devices that I've ever seen in my lifetime. And I'm going to show you today why that is. And does it really work? We were featured in Forbes back during the pandemic. And the thing that's amazing is that this is really changing the way we treat people with chronic pain and acute pain. This is non-invasive. There's little downtime. It takes 3 to 5 minutes to deliver it, and we're seeing 65 to 90% success rate. Our company, Softwave, has spent over $25 million in research and development. We have 46 different patents. We have Class 2 clearance for wounds, diabetic ulcers, burns, and we are a registered 510 device for reduction of pain and improvement of circulations. So that's fun. And this is a nice quote that, yes, it really works. We're seeing, 65 to 91% success. And this was with other doctors' failures. These patients have been to doctor after doctor. 53% of the people that come into our offices have already been around the gamut and looked for different things and have not found relief. And being a chiropractor for 30 years, that was frustrating when I would have a patient that would go get a cortisone injection or go get a second opinion on a joint replacement or something like that, because it seems like I had failed. We have over 130 peer-reviewed studies, and I can't wait to kind of get into those a little bit. But this is really, about how many more people you're going to help without having to refer out. I call it the ROII. It's a return on impact in your community first, and it's a return on investment secondly. And most of my docs are paying this off especially my max living docs, are paying this off in less than 110 days. And it's
Wow.
not working
Awesome.
every day. It's 2 half days a week.
That's amazing.
So we are, as you can see, you know, we're in some of the top teaching universities in the United States. We're at Harvard, Mayo, Cleveland Clinic, Walter Reed. Yale just ordered one. Shepherd Spine Center, one of the top 10 rehab hospitals in the world for paralysis. And we were on the PGA Tour. We're now on the Live Tour. We're in 6 different NBA teams, 6 different NFL teams. Just recently, the New Orleans Saints, Cleveland Browns, and Atlanta Falcons, and Denver Broncos. The Miami Dolphins, Dallas Cowboys, and Steelers have had one for 3 years. 6 different Major League Baseball teams. So it's been fun to work with that, because, you know, I used to sit in chiropractic college and look out the window and dream of working and consulting with these top professional organizations.
That's awesome.
You know, James Bradley, who's been the team physician for 32 years for the orthopedist, he not only has one for the Steelers, but he also brought it into his orthopedic camp at University of Pittsburgh Medical Center. We're also in neurosurgery and the urology department there. And as you can see, this is Jim Maurer. He's been the head trainer for Dallas Cowboys for 35 years. The 2001 World Series champions, Atlanta Braves, and Graham McDowell, who's a past US Open winner. I love this slide because after last year, the Braves literally popped champagne because we thought they said that they wouldn't have done it without having this technology. And this was a text sent to our founder, John Warlick. And this is Dr. John Boom. He's at the Miami Dolphins. He's the first doctor of physical therapy and athletic trainer to work in the NFL. And he's just very progressive and super excited to have him. Martin OMalley has 3 of our devices. I love what he says. He's like, if you're doing sports medicine in 2020 and above, you need this technology. And I like that. Like when Kevin Durant tore his Achilles, he flew from the Bay Area all the way to New York City. And right there in the OR, Dr. OMalley uses this on his patients after closing them up after surgery. And he says it best. He's like, hey, I'm not here to debate who's got the best shockwave device, because there's a lot of different categories. Because I can only tell you that I have 3. Okay.
Wow.
And that's huge. And he's the man. There's nothing else like this on the planet. We have both a primary and secondary wave that I'll show you in a minute. This is electrohydraulically produced supersonic sound waves that are traveling 3,355 miles an hour, can penetrate the depth of a soup can into the body. They've had wonderful success with this, using it as a lithotripsy. So for the last 40 years, they've broken up kidney stones, biliary stones, and even salivary stones with an 85% success rate. This is non-invasive. It's there's little to no side effects, and there's little downtime. And it takes 3 to 5 minutes to deliver in your office. So we're doubling and tripling what a doctor can make from an adjustment.
Right.
And the FDA labels this as a non-significant risk factor because there's minimal to low side effects. It has become the standard of care in Austria the last 12 to 14 years. They don't use cortisone injections anymore. They consider it as barbaric. Yeah, there's 33 negative side effects once you have cortisone. And the really cool thing is that in Austria in 2019, they started a spinal cord injury study. Now, this is pretty cool because they're a socialized healthcare system, and they're looking to really attack the most expensive conditions and diseases in their country. And number 1 and 2 is quadriplegic, paraplegic. So they created a national health mandate and basically said any spinal cord injuries would get our treatment done within 72 hours. Okay. Now that's right over a fracture. And what happens is you don't want a fracture to develop a hematoma because that swelling will block off blood supply and create permanent, irreversible damage to the spinal cord. So in the last 4 years of running it, looking at it, they've had a 50% reduction in spinal cord paralysis when compared to the previous 17 years.
Wow. Wow. That's awesome.
It's now considered the first potent therapy for spinal cord injuries. This is Wolfgang Shaden. This is amazing. He is the grandfather of Shockwave, and you're going to hear a debate between our founder John Warlick, and these are two of the top experts in this field.
So when you put, this is how the shockwave would develop. And when you put this source into an ellipsoid, you see how the shockwave is reflected and then comes to
No other shockwaves have a primary and a secondary wave.
This is what I wanted to say now.
Damn it.
And what you're seeing is,
But nobody ever measures the primary wave. All is minus 6B. It's never on the, nobody's ever measured.
That's
the
Wolfgang.
primary wave.
I think it's.
And that's our founder. So, this is another slide that I love. This is the mitochondrial. On the left is before Softwave, and on the right is the after effects, 10 minutes after. And what you're seeing on the left is the mitochondrial working in an anaerobic level and not utilizing oxygen properly. And on the right, you're seeing it almost supercharged, and it's processing what's called ATP, adenine triphosphates, at a higher rate, which allows our body to utilize oxygen better. This helps improve circulation. That's cyanosis on the left. You see that bluish foot, purple? And this is 2 minutes after a treatment.
Oh my goodness. Wow.
When I see cyanosis, I think sayonara. They're not going to be around long. But this is from 4 years ago. And this is a woman who lived in Philadelphia, who would fly down once a month until we got one of her doctors to buy one. And this is just the benefits. Basically, what we found over the last 10 years is wherever we place this device, there's a positive biological effect, from increasing VEGF, which is vascular endothelial growth factor, to stimulation of stem cells within minutes of treatment. But the biggest one that makes us $1 billion company is the downregulation of inflammation. And inflammation is really the silent killer and the main culprit for so much of pain and suffering. Any questions, gentlemen?
I don't think so.
There's a lot to learn here.
Yeah.
There is, and that's why you guys are coming on board is wonderful. And again, we have a wonderful training and education team. You just have to help us find more people and doctors who need this. But it does. It stimulates healing naturally. It decreases pain. We typically see within 3 or 4 visits, reduction from a pain level of 8 down to a 3.5. And that seems to be stable even 1 year later that we're looking at it. These are a lot of the research that we're doing is out of my clinic here in Atlanta called ATL Pain Institute. But we have over 24 papers that show we activate stem cells, which are the repairmen of the body. But again, modulation of inflammation. We are now considered a biotech company because we're stimulating these genes on our DNA helix, right? The double helix, specifically toll-like receptor 3 and 4 that help downregulate inflammation. And really, these supersonic sound waves that are traveling 3,355 miles an hour, they can penetrate the depth of a soup can into the body, and they're working on a cellular level. They literally trick the body into thinking there's a new injury without damaging tissue. And then finally, improving blood circulation. This is an important concept, guys. This is MechanoTransduction. This is what makes us different from so many other medical device companies and shockwave companies, is because we're using these sound waves that are compressing the cell by 2% in that middle picture and then expanding it by 10%. And that shearing force knocks a lot of oxidative agents off that cell membrane and allow nutrients to flow into the cell and waste products to come out. We're also shearing these extracellular and messenger RNAs and exosomes that are stem cell attractants. So they like, hey, we need help down here. We just got hit by supersonic sound waves. So this is an important concept, the concept of MechanoTransduction. There is no damage to the cell or cell membrane. And we use it for a lot of tendinopathies, any type of inflammation, anything with itis, arthritis, plantar fasciitis, epicondylitis, carpal tunnel. I've never seen anything work better for shin splints, chondromalacia patella, where that's a knee, where the knee cap isn't tracking properly. We saved the Austrian workers' compensation system over 70 million euros when it comes to non-healing fractures and non-healing wounds. So that's huge.
Yeah.
And really, we have basic certification course that your doctors will get right away when they order. We have an on-site training where we bring one of those national certified trainers to help launch that initial day on that training day. And we'll generate anywhere from $5,000 to $7,000 to $10,000 on that first day. And that's where the doctor is really taking 10 to 14 of his worst to worst patients and lining them up every 15 minutes. And we show them how to work on ankles, knees, hips, low back, failed back surgery, carpal tunnel, shoulder, elbow, whiplash. And it's really, we have a patent pending protocol that's a 10-minute or less.
Oh, wow.
We now have over 1,600 globally, 1,000 clinics in the United States. This is an older one, and 900 of those are chiropractors. So it's really fun that chiropractors tend to be the perfect healthcare providers to bring this to the masses. Because chiropractic's a wonderful profession, but I don't care how good your doctors are educating, they're still only attracting 10 to 12% of their community that will come in. That means 88 to 90% won't even think about going to a chiropractor.
And I think your 10 to 12% might be a little ambitious.
Yeah, well, we're looking to do that, but this, I believe, is the great equalizer. This is what's going to bring chiropractic into prime time.
I love it.
Because it makes us a non-invasive orthopedist with a real focus on true cellular regenerative healing.
Right.
Absolutely.
That's huge.
And over the last, like, you guys have spoke to more chiropractors than me, but over the last 6 years, I've had 3,300 doctors that I've worked with or talked with on the phone. And a lot of them are worried, are they going to have enough money to retire? Will their body be able to stand up to this rigorous lifestyle that we chose? And will they have enough money to put their kids in college? So this, on average, generates about $27,000 more per month. So for a lot of chiropractors, that's almost equaling or duplicating their chiropractic income.
Yeah.
You guys work with some higher end doctors, but this is really an easy way to add revenue. It's a great return on investment. It's 10 minutes. You get to see more people and different people that would have never come to your office. And again, it's nice to be the first in your community.
Definitely.
And, we're elevating healthcare without a doubt. This is a world-class technology that we're bringing into communities and giving more people access to regenerative healthcare. That's not going to cost them an arm and a leg. So average treatment plan is 5 or 6 sessions, and it's about $120 a session. So most people can afford it, and not a problem. And again, this may be the first potent therapy for spinal cord injury patients. I'm going to skip
this also said that Medicare, there's a Medicare reimbursement.
Yes, for wounds, diabetic ulcers, and burns. So that's for a multidisciplinary clinic. But Dr. Kyle up here on the left corner, he's one of our national trainers as well. He is, over the last 2 years, done over $1 million in Softwave. Dr. Corey did 41,000 within his first month. Dr. Jeff did 38,000 in his first 6 weeks. Dr. Scott up here to the right it collects $55,000 per month with 2 devices. He's done over close to 2 million in the first 3 years. Dr. Sue has generated 450,000 for the last 2.5 years. Dr. Todd did 64,000 in his first 7 weeks. Dr. George down here, right corner, paid it off in 9 business days.
Wow.
That's awesome. Oh,
Dr. Stacy and Nate Bloom, they did 122,000 in the first 70 days. So, and you know, you can see this one person collected $25,000. That was Michael Southwick in his training day. He holds the record. This one lady, it's just been unreal because it's duplicated what it took her 19 years to generate $35,000 a year in her chiropractic and acupuncture clinic. I think this is important. We're still considered pioneers. Any of the doctors that come in at this point, we're only in 1.5% of the entire chiropractic profession. So we have a lot of growth. And these doctors that you're bringing on board, they're really true innovators in our profession. And, you know, they're way ahead of the curve. And it could be 10 to 20 more years before we, you know, you start seeing this everywhere, but it will be everywhere because I love the predictable patient outcomes, but it's also a productivity and profitability increasing program. All you need is to add humans. So the thing you have to understand is, you know, people get scared of the sticker price. Oh, I want to go with this guy. They're just like Softwave. They're cheaper. They're made in Turkey. We can, you know, you want to stick with the leaders in the field. We spent over $25 million on research and development, 46 patents, $2 million to get our class 2 clearances. And the thing is, this OrthoGold 350, the supercharged version, it delivers 700 treatments per probe. So you get 2 brand new probes and 1 refurbishment. Each probe, if you just charge $100, which is somewhat low, will generate about $70,000 per applicator. You'll make $210,000 before you ever have to pay for a refurbished probe.
nice. Wow.
I think one of you asked how much that is.
Yeah.
Refurbish it. That's $3,500. But for any of your clients, especially your max living docs, we lock them in at $3,000. So we'll save them $500 per refurbishment. And they only need, you know, several, you know, 3 to 4 per year to generate.
Okay.
Wow. We appreciate that.
Yeah.
Okay. Yeah. I mean, and then, you know, we have, you know, Kevin Zylstra is the one who connected us. He has a wonderful 0 money down, 3-month deferred payment option. So
Amazing.
if you got it October 1st, you wouldn't make any payments October, November, or December. January 1st, you make your first payment of 2024. But by that time, I'd say more than 55% of my doctors have paid this off. And it's all gravy after that.
That's awesome.
So, yeah, let me see here. So it's pretty simple. We have the, you know, third-party leasing application that they fill out. We know within 45 minutes if they're approved. Once approved, they give us the thumbs up. We can deliver one of our devices within 10 to 14 days. They start their basic certification course and typically have a trainer in there within 7 to 10 days to launch it. And that's number 3. So it's pretty easy to get rolling.
That's amazing. You guys have a trainer on site for the launch of.
Yeah, we fly them in. No one else does that. There's other device companies that make you fly into Fargo, and you get to work on their staff and people. But this is taking the worst of the worst patients in their community and allowing them to see real results. And I think that's what patients and doctors love. So let the supernatural healing begin. That's what I always say. Oh, let's see if this plays. All right, so that one worked finally. Well, guys, that kind of completes our little talk, and I'm glad you were able to pick some time to work on this. I'd love for you to send this out. I'll share this in a few minutes with Kevin, and then we'll go from there. Any questions as we finish
I
up?
think we can tag this on our website right away.
Definitely. And we're very excited to get this opportunity to work with you guys and get this out to our doctors.
Well, especially going to ML next week.
Yeah,
I mean,
definitely.
that's a group you won't have to sell. You're just gonna have to show it.
And by the way, we're already in probably 22 different Max Living docs, including Kevin Knopfsinger was one of the first, Marissa Beard, David and Kim Erb are just wonderful. They've been so great.
They have two, don't they? One of each
Two,
leg?
yeah, they might even order the third. Jay Rojas has been awesome. Carl
Oh, yeah, we know
Santiva,
Rojas.
Dr.
Yeah.
Carlos De Leon. Yeah, I mean, Adam Duncan, we got them all over the place. So we've been,
We do all their initial clinic setups. We design the X-ray room, we do the lead planning. We do, we do a lot of work with the new ML clinics coming out. They call them the health centers. Then we
Oh, yeah.
also the coach doctors, we work with them.
yeah, the thing about the Max Living docs is, and I say this after being in healthcare for 30 years, they're probably the best communicators in our profession to really get out in their community to educate what, to get to the true source of the pain.
They've got it down to a science.
Yeah, they
They're
do.
well taught. Their presentations are locked in.
Mhm.
They know what they're doing.
Definitely.
All right, well, good. I'll send this over to you guys and we'll get that those flyers for you for that treatment. And thanks again.
Of course.